Rich here from Vet Triage. We are going through this issue of JAVMA, May 15, 2014, and we are talking about equine radiographs, the effective limb positioning on the radiographic appearance of the distal and proximal interphalangeal joint spaces of the forelimbs of horses during evaluation of dorsopalmer radiographs. So the image below shows how they will collect radiographs in the field. Now this paper comes out of the vet school in Colorado as well as University of Florida. So there's a good chance they have horses coming to them, in which case the horses are entering a building and it's more controlled settings versus being outdoors like this where the horse might be standing on uneven ground, or there's weather issues, or the horse is not being cooperative, or maybe the university has better equipment, etc. So keep that in mind, that they are trying to address here the ideal way, if you had the equipment and the scenario that can support the ideal way of collecting radiographs to assess the lower joints in a horse. But in the field, what they'll typically do is they'll have the X-ray here, the film, and then the machine here will shoot the beam to the joint, and it'll be imprinted onto this cassette, and then the cassette will be developed later on. I don't know if that's the way that I learned it, but this is many years ago, and so maybe they have updated ways of doing it. Probably, I assume maybe the ways now are digital, and there's no film that has to be processed or whatever. But just to show you, if you have never seen it before, a portable X-ray machine and the cassette that the image of the limb would get placed on. The objective is to determine the effective limb positioning on the radiographic appearance of the distal and proximal interphalangeal joint spaces of the forelimbs of horses during evaluation of dorsopalmar radiographs. It's an evaluation study, 14 forelimbs, 9 horses. So, right off the bat, it's a shame that the numbers are so small. But as you know, if you've been watching this channel, having a small number of cases in these papers is a very common, unfortunate issue. Procedures. Dorsopalmar radiographs of each foot were obtained with the forelimbs positioned squarely, meaning the metacarpus of both forelimbs was perpendicular to the ground as determined by visual examination, meaning abducted 0 degrees, which is considered the baseline. And then again, radiographs were collected at abduction of the limb at 5 degrees and 10 degrees abduction. Results. As the extent of limb abduction increased, the medial aspect of the proximal and distal interphalangeal joints become more narrow compared with the corresponding lateral aspect of those same joints. For both the distal and proximal interphalangeal joints, the mediolateral joint balance differed significantly among all limb positions. The conclusions and clinical relevance from this study were that the forelimb position significantly affects the mediolateral joint space, or joint balance rather, of the interphalangeal joints of horses. Thus, it is crucial that the forelimbs of horses be squarely positioned when dorsopalmar radiographs are obtained for accurate evaluation of the interphalangeal joint space and balance. All right, introduction. Results of another study indicated that the distal interphalangeal joint imbalance affects intra-articular pressure and alters the articular contact area, leading the investigators to suggest that the distal interphalangeal joint imbalance may predispose that joint to the development of osteoarthritis. In addition, improper mediolateral balance has been associated with sheared heels, chronic heel soreness, quarter and heel cracks, and ossification of the ungular or collateral cartilages. Evaluation of the interphalangeal joint spaces is best accomplished with dorsopalmar and lateral medial radiographs of the foot. It's interesting it keeps calling it a foot instead of like a hoof. To accurately assess joint balance, a horse should be standing squarely with its forelimbs on symmetric wooden blocks such that the metacarpus is perpendicular to the ground. So that's the exact positioning that they want. Here is a drawing showing the angulation there. And so I will tell you with the little black dot on the horse's anatomy. I'll say what that means here in a minute. This is an illustration of a horse standing squarely with the metacarpus of both forelimbs perpendicular to the ground at zero abduction when viewed from the front. That little dot is the intersection of the extensor carpi radialis, the brachialis, and lateral head of the triceps brachii muscles. Sorry about the lawnmower or whatever outside. Materials and methods. All horses included in the study were or had been previously used for recreation or competition and received routine foot care, meaning trimming or shoeing every 4 to 8 weeks. With regard to the dorsal palmar radiographs, with the limb in baseline position and abducted 5 and 10 degrees from baseline, dorsal palmar radiographs were obtained with a digital radiographic system, so it is digital. And then here's the perfect image of what they're looking for. Look how perfect that is. The joint spaces are amazing. Really nice job. So that figure shows a dorsal palmar radiographic image of the distal aspect of the forelimb in an adult horse standing squarely. So I think that they are radiographing way down here. The width of the space at the medial and lateral aspects of the distal, interphalangeal, and proximal interphalangeal joints, meaning the medial and lateral joint spaces respectively, were measured. And then you can see in the image we have in the thumbnail, there you go, and that's showing you the different A, B, and C. Is A is 0 degrees, B is 5 degrees abduction, and C is 10 degrees abduction. You can see how the joints change slightly there. So based on those images, A is standing squarely at baseline with the limb, and then B is the limb abducted 5 degrees, C is 10 degrees, and lateral is to the left of all the panels. For both the distal and proximal interphalangeal joints, notice that the width of the space, they're referring to these images here, right here, the width of the space at the medial aspect of the joint decreases, whereas the width of the space in the lateral aspect increases as abduction increases. Results. The mean length of the forelimbs evaluated was 0.89 meters. The mean distance required to abduct forelimbs at 5 and 10 degrees were 7.9 centimeters and 15.7 centimeters respectively. For both the distal and proximal interphalangeal joints, the space at the medial aspect became narrower and the lateral aspect became wider as abduction increased. Consequently, the joint balance increased significantly between baseline and 5 degrees, between baseline and 10 degrees, and between 5 degrees and 10 degrees abduction for both joints. Discussion. Results of the present study indicated that the limb position significantly affected the appearance of both the proximal and distal interphalangeal joint spaces on dorsal palmar radiographs of the forelimbs of normal horses. The mean medial-lateral joint balance of the distal interphalangeal joint increased from 0.4 millimeters at 0 degrees abduction or baseline to 1.6 millimeters at 5 degree abduction and 2.5 millimeter at 10 degree abduction. The mean distance that the forelimb had to be moved to achieve that abduction of 5 and 10 degrees was 7.9 and 15.7 centimeters respectively. The mean width of the forelimb hooves of all horses was 14 centimeters. Thus, lateral movement of the forelimb less than the width of one hoof has a significant effect on the radiographic appearance of the interphalangeal joint spaces and calculation of joint balance. Therefore, it is critical that the forelimbs of horses be properly positioned, meaning 0 degrees abduction, when dorsopalmar radiographs are obtained so that interphalangeal joint balance can be accurately assessed. The space at the medial aspect of the joint became more narrow and the lateral aspect became wider as abduction increased. However, not all joints transitioned from a balanced to an unbalanced state when the limb was abducted. Some horses had a joint balance less than 0 at baseline. As expected, forelimb abduction in those horses invariably caused the medial joint to narrow, lateral joint to widen, and joint balance was frequently achieved in those horses with the forelimb abducted. For accurate evaluation of the interphalangeal joint spaces, it is recommended that the horse be positioned squarely, meaning the metacarpus of both forelimbs are perpendicular to the ground as determined by visual examination when dorsal palmar radiographs are obtained. Generally, dorsal palmar radiographs obtained at 10 degree abduction were obviously malpositioned. Furthermore, the mean medial and lateral widths of the proximal interphalangeal joint space changed 0.4 millimeters or less between baseline and 10 degrees, and such a small change may not be readily detectable. A veterinarian experienced with equine lameness in both clinical and research settings becomes concerned about possible pathologic changes when the medial lateral balance of the distal interphalangeal joint is 2 millimeters or greater. In this study, the distal interphalangeal joint achieved a mean medial lateral joint balance of over 2 millimeters with limb abduction of 10 degrees. So I'm trying to tell you here that if you are using these changes as a means to determine pathology, but the radiographic positioning is not ideal, that you might be diagnosing conditions that aren't really there. Abduction of the limb 10 degrees from baseline results in a 0.4 millimeter increase in the joint balance, and although that may seem inconsequential, it represented a 20% increase in the width of the lateral joint space and a 20% decrease in the width of the medial joint space from baseline, which might be clinically relevant. Finally, in conclusion, forelimb position has a significant effect on the radiographic appearance of the interphalangeal joint spaces of the forelimbs in clinically normal adult horses. In the field, a plumb line or laser level can be used to aid in ensuring that a horse is squarely positioned in preparation for obtaining dorsopalmer radiographs of the forelimbs. When there is radiographic evidence of narrowing of an interphalangeal joint space, it is important to consider clinical findings as well as limb position during radiographic examination, which can be difficult to determine solely from radiographic appearance. Solid study, man. Very good, very specific, very narrowed evaluation. It's great. Other than having probably not enough sample size, it would be great, and also it'd be cool to, actually test their theory in the field outside of university as well. So, all right, we'll see you guys tomorrow. Bye bye.